I understand that you quit smoking. Could you tell me a little bit more about it?
I quit smoking soon after I learned that I was pregnant with Jamila, and I've not smoked since.
Oh, that's great. How many cigarettes did you smoke per day?
I smoked about 15 cigarettes per day, sometimes more on the weekends. I started smoking when I was 13 years old. I guess I've been smoking for over 10 years now.
That's a lot of cigarettes. What was it like for you when you quit smoking?
Actually, I quit cold turkey. And it wasn't as difficult as I thought it would be. I simply made a decision not to smoke. I got rid of all the cigarettes in the house, set a quit date, and quit smoking all at once. It wasn't that difficult. I mean, I missed them, I guess, but I didn't experience that severe craving, and I wasn't that uncomfortable or irritable. I don't even think I gained weight.
Well, my impression is that you felt it was very important for you to quit smoking when you learned that you were pregnant.
Yes, I wanted to have a healthy baby, and I've read so much about the harmful effects of smoking during pregnancy.
Well, I think you should be quite proud of yourself. By stopping smoking, you improved your chances of a normal pregnancy and a healthy baby. You also did something important for your own health as well.
Yes, I am quite proud.
Now, what are your thoughts about remaining smoke-free?
Well, I don't ever want to return to smoking. I want to be a good role model for Jamila, and I don't want her to have to breathe the smoke from my cigarettes.
Well, how might secondhand smoke from your cigarettes affect Jamila?
I know it's not good for her lungs and breathing. Both my nieces have asthma, and my sister's smoking really makes it worse for them.
Oh, you're correct. Your smoking can harm Jamila in many ways, adversely affecting lung growth and respiratory health and increasing her risk of sudden infant death syndrome. Your smoking also could increase Jamila's risk of lung and ear infections.
Yes, I've read about that.
You seem to have a good understanding of how your or other people's smoking may affect Jamila. What steps can you take to protect Jamila from other people's smoke?
Well, I've already declared my house smoke-free, and I do not let anyone smoke around her outside the house or in the car.
Well, you're doing a great job, and I hope you can keep it up. Your baby has benefited greatly from your stopping smoking and protecting her from environmental tobacco smoke. It's also important for you to remember that you have benefited in many ways by stopping smoking. After all, your health also is important.
You're right, Doctor. I do feel better as a non-smoker. And the extra money feels good as well.
Not to mention reducing your risk of tobacco-related diseases such as cancer and heart disease. I'm very pleased, and I'm sure that your efforts will benefit you as well as Jamila. Now, before we end this discussion, however, I do want to ask you about the future. What obstacles lie ahead?
Well, I do have to be persistent. And my husband quit smoking along with me, but I know that he has started smoking a bit outside the home. Now, that could be a problem. He was a heavier smoker than me. And so far, however, he has gone along with not smoking in the house around Jamila, or around me for that matter. But other than that, I don't anticipate any real difficulties.
Your husband's smoking can be difficult, although it's good that he doesn't smoke in the house or around you or Jamila. It would be great if he could stop again. I have some material on quitting smoking. How would you feel about sharing it with your husband?
Oh, I would be glad to share the material with him. I know he would look it over because I'm sure he doesn't want to become a heavy smoker again. And he worked hard to quit smoking, and it would be great if we can reach him before he starts in again.
Well, let me review the material with you, and when you return for Jamila's next visit, we can talk some more. How's that sound?